By the end of March, there have been more than 300 cases of COVID-19 reported here in DuPage County. And along with that, unfortunately, several deaths have been reported as well. Today on our roundtable program, we will again be talking about Addison's response to the COVID-19 pandemic, but also taking a look at how DuPage County has been responding to this crisis as well. Joining me today, along with Addison's Mayor Rich Veenstra, is Karen Ayala, the Executive Director of the DuPage County Health Department. Karen has been in that position for 6 years, though it probably seems a little bit longer than that right now, Karen. Welcome. We're very glad that you could come up to Addison today. We know this is a busy time, and in a few minutes we'll be able to talk a little bit more about how the County Health Department has been working with residents in our community.
Thank you for having me.
Very good. We're glad to have you. Mayor, thanks for coming back in once again.
My pleasure.
When you see a number like that, 319 some cases, 17 alone just in Addison as of March 31st, it must be very concerning, very daunting to you and as well it should be everyone in our community. What do you think causes those numbers to all of a sudden be coming up as quickly as they are at this point now? Here we are well 1 month into the pandemic situation that we have been dealing with here in this area.
Well, you know, on first blush, the numbers are alarming. And I think it's very important for all of us to understand where the numbers are coming from, how they're determined, and what their implications are. And, you know, we're in a very serious situation, but we also want to be realistic about what is being interpreted. We had seen day before yesterday 8 reported cases in Addison. It jumped up to 17 in 24 hours. And rightly so, people who aren't following the numbers or haven't been in the past look at that and say, wow, it's a 50 or 100% increase. That's, you know, tragic. Well, the reality is the virus has been in our community as well as across the country for weeks, for months now. So we are just coming into starting to really be able to analyze and look at test results and identify the cases. So the jump we're seeing are really twofold. One is because we're doing more testing. The other is because the virus is still active and being transmitted. So we have to look at it realistically and say, yeah, we anticipate to see numbers go up. That's certainly a major reason for us to really enforce and be very concerned about gatherings, staying segregated, sheltering in place, all the things that we've been talking about over the last couple of weeks. That is important in minimizing the spread, but also we have to be very cognizant that the numbers are going to go up. We expect those because there's additional reporting.
Are you bothered that from time to time we get conflicting information, or what I might say is information where we hear the governor come out and make a statement and then the president of the United States appears on television, and sometimes they're almost getting into a bit of it almost becomes a turf war, and it really shouldn't be, because lives are at stake when we talk about all of this. Is this becoming a political issue in some cases?
Well, I think, yeah, you know, there's politics and everything. I think as long as we at the local level, at the county level, recognize this is about people, this is about our relatives, our friends, our families, our neighbors. That's the focus it has to be on. And the infighting and finger pointing, there's really no place for that at this point. It's getting down to business, figuring out what we need to do to minimize the impact and move forward.
Yeah, I think people are tired of hearing about states saying they're deserving of number of ventilators and N95 masks as opposed to another state. It's almost as though we're pulling up state sovereignty all of a sudden and saying, well, it's this state deserving of the other, and that's really not what this is all about.
No, but I think fear and fear of the unknown comes into play. People tend to react differently when they're afraid, and people are afraid, and quite frankly, the media has done a lot to exacerbate that feeling. So again, looking at numbers, realizing where they're coming from, understanding what's being done to address them is the key, I think, right now.
Well, we want to welcome Karen Ayala, Executive Director of the DuPage County Health Department, with us now. And Karen, thanks for coming in once again. And let's go back to maybe early February, before COVID-19 became the watchword at not only your health department, but many other agencies, public health agencies across the country. In very general, broad terms, can you talk about what is really the job of the health department, and why do you get involved so dramatically when it comes to an outbreak such as the COVID-19 COVID-19 pandemic?
Sure. So actually we've been at this with COVID-19 since January 22nd of this year. So we're reaching almost our 75th day of response, active response to this pandemic. But one of the reasons why we are identified as a first responder for public health emergencies is because our mission at the health department is to promote physical and emotional health, to prevent illness, injury, and disability, and to protect health from environmental risks. So one of the key and critical tasks that we have always had when it comes to disease tracking and investigation and reporting is the element that is now been magnified 1,000-fold with COVID-19. So we've always tracked communicable diseases, whether that be things like TB or measles or mumps or things like that. We are the place that people report, and then we identify concerns within the community and help with the response. This has certainly taken us to that.
Mm-hmm. Then in your tracking and reporting, is it your job to try to determine sources for things such as that? And I'm talking about in all those things that you just listed, where the problem could lie.
Absolutely.
Could be in a school, could be in another type of public gathering.
Correct. And the other area that we spend a lot of time in during typical days is investigating foodborne illnesses and outbreaks and trying to identify the common source of that. Really not so much to assign blame, but to make sure that we can implement and equip people in those businesses with the necessary tools so it doesn't happen again.
So how has this impacted your regular operations, daily operations? We know that you've had to deal with a lot of media inquiries. I mean, you've come up here and we're appreciative of that, but you've had to do a lot of other things as well, reporting, and we know you've rolled out some new technology as a result of that as well. Sure.
So we typically have spent probably 5% of our time doing communicable disease and epidemiology, and 95% doing other things. And what we have seen over the last 8 weeks is really that has been flipped. So we have retained some of our very core and critical essential services, things like TB monitoring and control, making sure that individuals with psychiatric illnesses have access to their medication, making sure that young families, particularly pregnant women and infants, have access to WIC for food vouchers, those kinds of things. But essentially we've taken our 600 person workforce and flipped them over to emergency responders right now.
And that's what they're working on right now?
Yes.
In all different forms?
Absolutely.
Right.
Absolutely.
Now, at this point, what are you learning from COVID-19 in terms of the response? What are some of the things that the health department is doing, kind of that boots on the ground sort of approach? What actually would be taking place, at this point?
Sure. So although this is a novel virus, and it's certainly something that none of us who are alive currently have ever seen the likes of, we've taken lessons that we've learned through other outbreaks and other opportunities to learn about outbreaks and really brought them to bear. So even as recently as the H1N1 outbreak, SARS, MERS, those kinds of things, we know that education is critically important. As Mayor Veenstra mentioned, we are in a serious situation. We're not exactly sure what's going to happen next, but what we do know that if we can provide people with actions that they can take to help reduce their risks, we will minimize the unfortunate and negative impacts on our communities.
And so much so that on March 30th, you launched new technology, and that was a dashboard. And we're going to share that with our viewers so people can actually access this at home online.
Sure.
When we take a look at that now, as it appears here on the screen for our viewers to notice, can you point out some of the features of this dashboard, Karen, and tell us what viewers and what residents should be looking for when they access this online dashboard for COVID-19?
Sure. So in the middle, you'll see the graph of the county that's broken down by municipality, and it has the total counts for that municipality. In the top left, with the red numbers, you'll see the total confirmed case count, and that's where I'd like to pause for just a minute and say those are only the cases who have been lab confirmed that are identified on in this graph.
Not necessarily a person who is staying at home and self-quarantine, basically.
Exactly, and that's what we've asked people to do. Folks with symptoms consistent with COVID-19, things like a fever, a cough, some mild shortness of breath. We're asking for people with mild to moderate symptoms to really maintain themselves at home, because it is supportive care that that they need to provide. And so that 319 is a lot of people, but it's certainly only a small percentage of the overall disease prevalence in our community.
Right. Then the map also had a breakdown, I think to the right as well, by municipality. Once again, you had a kind of a timeline of how that.
And we have age groups.
Below it, excuse me.
You'll see under the 319 that the cumulative number of cases, that is what we refer to as the epi curve. We are clearly on the upswing of the epi curve. That's also when you hear flatten the curve. What we're trying to do is maybe we'll have the same number in 3 months. We'll have the same number of cases as other communities, but if we can help flatten that curve so it doesn't jump up dramatically and really inundate our healthcare systems, that's where we're at right now with our response.
Right. And then, as I said, each municipality has its own listing. And I want to also advise our viewers that was as of March 31st, that 319 number that you saw, with all likelihood going to be changing.
It will. And again, to the mayor's point, we absolutely anticipate that although we're taking measures right now to minimize the spread of the disease, we will see increases, and we will probably see dramatic increases. And so that is the expectation. Of course, it will create angst and anxiety in residents and in ourselves, but it is what we expect.
So let's go over some of the basic rules. What do people need to know when it comes to prevention? They've heard this any number of times, and these are some basics as well, but it bears repeating and reinforcement from your position.
Right. One of the most surprising elements, surprising in terms of the difficulty to influence personal behavior, is if you feel sick, please stay home. I think we have gotten so used to pushing ourselves to perform, produce, whatever, that we've kind of lost our barometer. If we're sick, we need to stay home. And if there is any one thing that we could do that would almost be magic, it would be that. So even if you're in a house that you share with other people, the more you can isolate yourself when you have symptoms, the better off you are. If you need to go out, either to work or for essentials that all of us do, grocery shopping, that kind of thing, trying to maintain a safe and healthy. We've heard it called social distancing. We're trying to reinforce the idea that it's healthy distancing. So that
some people do that naturally. They just sort of kind of go off in their own way.
Absolutely. And then respiratory, etiquette and hygiene. If you're going to cough or sneeze, cover either with a Kleenex or the inside of your arm. Monitor your health and make sure that not only are you monitoring things like fever in your family, but act upon them. Again, reinforcing the idea that if you're not feeling well, isolate yourself immediately.
What do you see coming up in the future? Do you see things getting back to normal, or will things be getting back to normal? Many people now call this the new norm. We're getting all these new terms, social distancing and the new norm, and I mean, what does that all mean to us, really?
Right.
From your perspective.
So I think will we get back to some of the things that we enjoyed so much, and I absolutely believe so. Things that things that we took for granted, I guess. The idea of being able to shake hands or embrace or, you know, play and work and shop together. I know that your technology really helps us, but we are at our very core social beings, and I think that we, most of us, derive a great deal of energy from being around each other. So returning to our familiar traditions within the community. On my way here today, I passed a number of churches, and it typically is a time like this that people rely on their faith communities, and now those are either unavailable or available in very different ways. So I think we'll absolutely return to those. Some of the things I hope we don't forget, though, when we get through this pandemic, is the feeling that we need to be concerned about how our own actions impact other people. They can either help or hurt our family, friends, and our neighbors, and I hope that that lesson stays with us for a while longer. I also hope that we'll realize the critical interdependence that exists between each and every human being. We like to think we make it or break it on our own, but in fact we are part of a tapestry called a community. So supporting each other. And then finally, I wouldn't be giving my role credit if I didn't mention that I hope the realization regarding the importance of public health, particularly when woven together with health care, remains top of mind. Yeah,
it is important, and it's also something that should be stressed 365 days a year, absolutely, regardless of whether or not we're dealing with a pandemic. In fact, if anything, good to educate yourself before you need to know these things. Right. That goes for just about any type of mobilization of any type of public service where a community can be impacted, such as we are having right now, is to be aware. Be aware of your public safety services, be aware of governmental services, and certainly in this area, public health.
Absolutely.
If our viewers have any questions, they want to access the dashboard, we should probably give the website for that, so people can look that up and start tracking it, because it's good critical information. What do you suggest that our viewers and residents do?
Sure. So they can visit the dashboard at the health department's website. That's www.dupagehealth.org. We will update the map daily around 4 p.m. So they can check that out there. If I could also give a call center we have established for people who have concerns or questions or issues that they'd like to address regarding COVID-19. We've established a hotline, 630-221-7030.
Okay, very good. So again, it's DuPageHealth.org is the website where you can access that dashboard and interactive map or get any other information, or the hotline for the DuPage County Health Department, the call center, 630-221-7030. Karen Ayala, Executive Director of the DuPage County Health Department, thank you very much for coming in today. It's valuable information, really, and we appreciate the time you've taken. And Mayor Veenstra, this is really a great opportunity to educate our residents, I think, on this topic from the position of a county agency, and that is the Health Department, because they are the lead agency when it comes to responding.
Go-to people.
Very good. Thank you very much, both Mayor Veenstra and Karen, for being with us as well. A couple of reminders before we close. Again, the website for the DuPage County Health Department is DuPageHealth.org, and their call center, 630-221-7030. Please check out the Village of Addison's official website, which is AddisonAdvantage.org, for more information on this subject. The Facebook page is Village of Addison. Our Twitter feed is @AddisonVillage. We again encourage you, residents and businesses, to sign up for the Code Red notification system so the Village of Addison can get information to you in a timely manner, and to download the Addison Connected mobile app, where you'll be able to access the information that you will also be able to find on the Village website. One other reminder, if you are interested in making a donation to the local food pantry at Addison Township, their website is that's AT for Addison Township, atcares.org, and they would certainly appreciate hearing from you, and any donation that they would be in need of would be greatly appreciated. Thanks to our guests today, and thank you very much for being with us as well. I'm Don Weiss. Thank you for joining us.